Hi, and good afternoon to Dr. Sida and also my fellow friends. So we are from Group 2B and we're going to present our case presentation for MDJ 4382 Gerontological Practicum. So these are my fellow members. So these are the outline of the presentation and which include profile, pathological changes, pharmacal management, physical, functional, and psychological assessment, diagnostic or lab result, therapeutic treatment, nursing care plan, and health educations. So client profile will be explained by me and the other will be explained by other colleague. So about the client profile. So Mr. X is a 79 years old. He is a betrayer from public preaching and a Christian. He lives with his daughter, son-in-law, and two grandchildren in a single house. He is a widower and his wife had passed away from kidney failure. And with his late wife, he has 7 children, which include 4 sons and 3 daughters. He is a former contractor, and before falling sick, he is self-employed in his garden. And then he is fully supported by his family. And he also a social smoker and drinker. And he has underlying disease called benign prostatic hypertrophic (BPH), which is diagnosed in 2008. And on the same year, he had undergone surgery. And then after the surgery, he has to take his medication on tablet finasteride and tablet doxazosine. If he does not take this medication, he cannot pass urine. And also he has an appointment every 6 months in a year in the Euro Clinic in Sarawak General Hospital, and otherwise he has no other medical history. So the reason why he admitted is because he is found by his daughter lying on the bed with body weakness at the left side with slurred speech and facial asymmetry. And then he immediately admitted to emergency and trauma of Syrian hospital and suspected to have stroke attack. Then he is transferred to Sarawak General Hospital for further management. He is referred to Medical 3, Level 9. Interventions such as X-ray, ECG, CT brain, hypocount, nasogastric, and catheterization, bladder drainage insertion were done. He is diagnosed with right total anterior circulation infarct, TACI, likely cardioembolic, which will be explained by my colleague on how this disease occurs. And then his blood pressure is strictly monitored and medication is served as doctor prescriptions upon admitted to HGH. And then he is transferred to Sarawak Heart Center on 12 January 2021 in the evening after spending 3 days in HGH. This is because for his rehabilitation purposes, and also the family member preferred to Sarawak Heart Center for the patients for Mr. X comfort to get the treatment compared in HGH.
I will talk about pathological changes. The patient is diagnosed with right total anterior circulation infarct, which means TACI. TACI is a type of cerebral infarction affecting the entire anterior circulation supplying one side of the brain. TACI is an ischemic stroke when the body stops supplying blood to the brain. Ischemic stroke is the most common type of stroke and occurs due to a blockage in the arteries around the brain. And the blockage reduces the blood flow and oxygen to the brain, leading to damage or death of the brain cells. The most common cause of atrial occlusion involving the major cerebral arteries are emboli. In this case, the patient has a history of atrial fibrillation. Atrial fibrillation describes the rapid irregular beating of the left atrium of the heart. This rapid contraction of the heart are weaker than normal contraction, resulting in slow flow of blood in the atrium. The blood pools and becomes sluggish and can result in the formation of blood clots. The clot leaves the heart and travels to the brain and causes stroke by blocking the flow of blood through the cerebral artery. The blood clots travel to the brain and cause occlusion at the middle cerebral artery. The middle cerebral artery, MCA, is the largest of the intracerebral vessels and supplies through its branches almost the entire convex surface of the brain, including the lateral frontal, parietal, and temporal lobes. The lenticulostriate branches of the MCA also supply the basal ganglia of the brain. In this case, the result of brain CT scan of the patient finds multiple areas of brain involvement which are hypodensities over right middle cerebral arteries, and also he has all infarct over vasa ganglia and thalamus. In addition, the contribution of age and undiagnosed hypertension which makes him have high risk to get ischemic stroke. And then when the occlusion at the middle cerebral artery occurs, oxygen supply is interrupted. Consciousness will be lost within 50 seconds. Anterior cerebral brain cells will slowly start to die after 4 to 5 minutes of oxygen deprivation, and ischemic stroke occurs. This is the symptom of right total anterior circulatory infarct. First is left hemiparesis, which is unilateral paresis, weakness of one entire side of the body. In this case, the patient has left hemiparesis. It's a variable involvement of face, upper and lower extremity. Second is left-sided sensory loss, usually involve all modalities, decreased stereognosis and gravithesia. Next is left homonymous hemianopia, condition in which a person sees only one side. Next is dysarthria. In addition, neglect of the left side of environment. Next is anosognosia, which is a lack of ability to perceive realities of one's own condition. Next is somatognosia, loss of recognition or awareness of part of the body. And then loss of prosody of speech, and lastly is flat affect. Based on this condition, the theory using is wear and tear theory. It suggests that organs in the human body have a fixed amount of energy. So aging-related changes is occur in the cardiovascular system and then affecting the myocardial layers. The collagen fiber proliferate with aging are found around the capillaries of myocardial layer. Changes in the cardiovascular system are exhibited in arteries, particularly, and the arterial walls become thick and hard. Glycosylation reaction takes part in hardening the artery, and the process is aggravated by harmful stress such as smoking, drinking, poor diet, or muscular strain. So next, I will pass to my friend.
Gerontological management. The patient has been prescribed with Flexane 40 mg OD. It is administered through subcutaneous injection. The indication for this medication is to prevent embolism and give brain thrombosis. For the nursing responsibility, first, assess for side effects and adverse reaction of medication such as easily bleeding and nausea. Next is administer the medication in aseptic and accurate technique of subcutaneous injection. Next, the patient has been prescribed with aspirin 300 mg OD, administered orally. It is used to prevent blood clot formation. For as a nurses, we need to assess for side effects of the medication such as easily bruising and bleeding. Monitor for lab result of PT and PTT for any coagulation disorder. The patient was also prescribed with bromhexine 8 mg TDS. It is used to treat chest congestion. As a nurse, we need to assess the characteristic of mucus such as the thickness to evaluate the effectiveness of the medication. Atorvastatin 40 mg on night administered orally. It is used to lower the bad cholesterol levels such as LDL and triglycerides. So the nursing responsibility is first, we need to assess for side effects of the medication such as blood urine and weaknesses to identify the occurrence of rhabdomyolysis, in which is a serious syndrome caused by muscle injury. So the nurses also need to monitor lipid profile to evaluate the effectiveness of the medication. Lastly, the patient was prescribed with esomeprazole 40 mg OD administered orally to reduce the stomach acid production. The nursing responsibilities for this medication, firstly, we need to assess the presence of side effects from the medication such as constipation. And we need to monitor for heartburn as the esophageal sphincter weakens in elderly, causing stomach acid secretion.
Next is physical examination. This assessment was done on 12 January 2021. For his head scalp are clean. There is no rashes or dandruff were found. For his eyes, no discharge were observed. His conjunctiva is pinkish in color, and this patient is wearing glasses when he was at home. His ears and nose are clean and no discharge were observed. For his mouth, it has a full odor. This is because the presence of blood clot precipitated on his tongue due to the patient beating his own tongue during NG tube insertion. His lip is also very dry. Next, for his neck, there is no signs of lymph node enlargement or thyroid enlargement. For his respiratory system, his breathing pattern is normal and regular. His lung expansion are symmetrical on both sides, and no dull or abnormal sounds heard upon auscultation. For his skin, it appears to be dry, wrinkled, and warm. No lesion or rashes were observed. For his upper and lower limbs, this patient is unable to move his left arm and leg due to left hemiplegia. He was unable to feel anything when being touched, but is able to feel pain. This patient is able to move his right arm and leg freely. Capillary refill is less than 2 seconds. There is no signs of cyanosis, and petic edema were observed. His abdomen appears to be clean and no rashes was found. It is soft and not tender. No abdomen distension or liver enlargement were noted, and his bowel sound is present upon auscultation. And finally, for his vital signs appears to be normal. According to person's environment fit theory, it tells that the person and environment are influencing each other. Although individuals with functional limitation do have difficulties when performing ADLs in the environment that they are living in. Based on Katz index, patient was unable to perform bathing, dressing, toileting, transferring, and feeding on his own. Patient also requires assistance from other people during his hospitalization. Therefore, it is important for the nurses to assess what intervention can be made in order to help the patient to do ADLs independently by adapting to the environment. For functional assessment, Katz index will be used to examine patient's functional abilities. For our patient, he is unable to do activities of daily living independently. This is because patient is bedridden due to left hemiplegia as a result of his stroke attack. Therefore, the patient is highly dependent, thus his needs are being assisted with the help of his daughter who are living with him before. Inability of doing activities explains that the patient is severely disabled with a score of 0 point. For his Morse-Hall scale, on 9th January 2021, upon admission at Sarawak General Hospital, the patient scored 70 in Morse-Hall scale. However, on the day of the interview, 12th January 2021, the score was still the same, but the patient has shown an improvement to move his right leg, but still weak. He maintains a high risk for fall. For his psychosocial assessment, Elderly Cognitive Assessment Questionnaire was used to examine a patient's psychosocial abilities. Upon assessment, patient was awake and focused during the interviews. He made eye contact and kept moving his hands when answering the questions. The questionnaire, Section 1 Memory, the patient was able to score 2 points, where the patient was able to remember and repeat the number after being told, and also the patient was able to remember and answer the questions about his age correctly. In Section 2, Orientation and Information, the patient was able to answer 2 points, where patient was able to respond questions about what place is called, and also what was your job before. And lastly, for Section 3, Memory Recall, patient was able to recall and correctly tell the number again after 10 minutes. Therefore, from all of the questions, half of the questions were correctly answered by the patients. Thus, this shows that the patient has still some good memory recall. Based on the score mentioned above, patient is in borderline case in terms of his psychosocial assessment.
Diagnostic and lab results. As we can see on this table, patient white blood cell is slightly higher than a normal range, and this may indicate a signs of inflammations or infection in the patient body. While patient's red blood cell, hemoglobin, hematocrit, and platelet level show a normal result that is within a normal range. And for the patient's sodium level, it shows a slightly low than a normal range, which is 131 mol per liter. And this may due to the medication side effects such as vomiting that can cause the patient to become dehydrated. For the patient hyper counts, in the morning we can see that patient blood sugar level is within the normal range, which is 6.7 mol per liter, while in the evenings, patient blood sugar level is slightly higher than a normal range, which is 8.2 mol per liter. This is made due to when the blood sugar was taken, patient just finished his dinner. Next, I'm going to pass this to my friends.
Therapeutic treatment, it is divided into two, medical management and pain management. For medical management, the patient had ECG on 9 February. It is interpreted as atrial fibrillation, whereby the rhythm is irregular, heart rate is 69 beats per minute, no visible P wave, QRS is normal, which is less than 0.12 seconds. P does not exceed QRS, and PR interval is unidentified since no presence of P wave. CT brain, the finding shows that the patient had hypodensities at the right insula, right vessel ganglia, and right external capsule. Multiple well-defined hypodensities in the left corona radiata, left vessel ganglia, and left thalamus. No presence of intracranial bleeding, hydrocephalus, and midline shift. Vessel systems are preserved, peronasal sinuses and mastoid air cell are clear. No valvocation of fracture. X-ray was done on 12 January as the patient had complained of pain at the right shoulder and had history of branch falls on his shoulder, and he did not seek medical attention after the incident happened. Next is nursing management. Firstly, 4-hourly observation was done mainly on blood pressure, pulse rate, respiration rate, oxygen saturation, and pain score. It is used to detect changes from the baseline data. Continuous monitoring was done for early detection and management of any abnormalities. Positioning for the patient was done frequently, including recumbent, semi-convex, left or right lateral for every 2 hours. This is to prevent the patient from developing pressure ulcer, as it is more prevalent in patients with activity restriction and confined to bed. Glasgow commercial is used initially as a baseline information and in the long term provides an evaluation for the patient's neurological status. On 9 January, the patient had scored GPS of 10/15, whereby I scored 3, verbal 2, motor 6, and motor 5. On 12 January, the patient had shown progression with the GCS score was 14/15, I scored 4, verbal 4, and motor 6. Sectioning was done for 2 to 3 times a day to clear the accumulation of mucus in the airway and provide comfort for the patient. It was noted that the patient had moderate amount with thick whitish secretion. NGAT feeding, the patient has started feeding with 50 ml of plain water and subsequently for 50 ml of N-optimum for 3 hourly, and gradually increased to 100 ml, 150 ml, and to 200 ml after the patient showed tolerance to only each amount administered 2 times for 3 hours. Blood sugar monitoring showed that the patient's blood sugar ranged from 5.8 millimole per liter to 6.7 millimole per liter. The medication was served based on doctor's prescription. For rehabilitation, the patient has been referred to a physiotherapist and occupational therapist for rehabilitation. The physiotherapist aims for the patient's independent evaluation. Meanwhile, for the occupational therapist, the aim for the patient is to enhance the patient's independent level of performing instrumental activity of daily living.
For nursing care plans, the nursing care plan that we can do for this patient is impaired physical mobility related to hemiparesis, loss of balance and coordination, spasticity, and brain injury as evidenced by a limited range of motion and decreased muscle strength. Goal: patient will increase the strength and functions of affected or compensatory body part. The first nursing intervention that we can do for these patients is we need to assess for the affected site, affected affected site for the color, edema, and other signs of compromised circulations. This is because edematous tissue are more easily injured and take time to heal. We also need to change the patients at least every 2 hours and possibly more often if placed on the affected site. This is to reduce the risk of tissue injury due to the affected site has poorer circulation and has reduced sensation. Next, we can probe the extremity in the functional position such as use footboard during the period of basic paralysis to prevent the contraction and foot drop and facilitate the use when the function is returned. We also can place a pillow under the axilla to abduct the arm. This is to prevent the adductions of shoulder and flexion of the elbow. We also can elevate the patient's arm and hand to promote the venous returns and help prevent the edema formation. We also can assist the patient with exercise and perform range of motion exercise for both unaffected and affected side. This is to help in reducing the muscle stiffness and spasticity. It also helps to prevent the contraction. Evaluation. Patient is able to increase strength and function of affected or compensatory body part. The next nursing care plan for this patient is self-care deficit related to stroke sequelae as evident by the impaired ability to perform ADLs. Goal. Patient will perform self-care activity within level of own ability. The first nursing intervention that we can do is we can assess the ability and level of deficits of patient in performing ADL. This is to aid in planning for meeting individual needs. We also can avoid doing things for patients so that patients can do but for themselves but provide assistance as necessary. This is to maintain the self-esteem and promote the patient recovery. We also need to be aware of the impulse action suggestive of impaired judgments because this may indicate a need for additional intervention and supervisions to promote the patient safety. We also can provide a positive feedback for the effort and accomplishment of the patients to enhance their sense of self-worth, promote independence, and encourage patients to continue their effort. We also can teach the patient to comb hair, dressing, and wash. This is also to promote the sense of independence and self-esteem of the patient. We also can refer the patient to the physical and occupational therapy because rehabilitation helps to relearn the skills that are lost when the part of brain is damaged. It also teaches a new way of performing tasks to circumvent or compensate for any residual disability. Evaluation. Patient is able to perform self-care activities within the level of own ability. Next is health education. The health education that we can give to the patients is we can advise the patient to drink more fluid and eat food with a lot of fiber to prevent the constipation. We also need to educate the patient to stop smoking and drinking alcohol. We also need to advise the patient to take a healthy diet and reduce the salt, fat, and cholesterol intake in their diet. We also need to advise the patient to perform all the exercise that have been taught by the physiologist in the hospital to prevent a joint stiffness. We also need to educate the patient to avoid sleeping on their affected side and educate patients also about the side effect of their medication. We also need to encourage the patients about their own personal hygiene as soon as the patient can sit up. We need to inform the patient that they cannot stop taking their medication without the doctor permission. And lastly, we need to encourage the patient to follow their appointment so that patient is updated with his own progress. Next is health education for the family or caregiver. For the family, we can provide a counseling and support to the family. We also can give the family information about the expected outcome of the stroke and advise them to avoid doing things for the patients that they can do by themselves. We also need to inform the family member that they need to provide a self-help devices to the patient such as extension with hook for picking things up from the floor, toilet riser, long handle brushes, drinking straw, leg bag for catheter and shower chair to enable the patient to manage for themselves. We also need to advise the caregiver to change the patient position every 2 hours and access for pressure at the bony prominence. We also need to advise the caregiver to use a simple word or sentences and speak slowly with the patients since they may have a language and speech problem. We also need to encourage the family member to approach the patient with a supportive and optimistic attitude. Thank you.